Hi, welcome to this revision session for COVID-19 vaccination teams. We're recording this session during December 21, following the announcement of the targeted measures to prevent the spread of the COVID-19 Omicron variant. The Omicron variant contains a large number of mutations, and early indications are that this variant is much more transmissible than Delta. The good thing is our vaccine still appears to reduce hospitalisation and death. So this is a revision session. You've probably all completed your e-learning, and if needed, you've had your practical competencies signed off. If not, please arrange to do this as soon as you can. Also, make sure your anaphylaxis training and your life support training are still in date. Both registered and non-registered staff, please make sure that you have revisited the e-learning to see if there's any changes. And if it's a while since you've done your online training, you may want to repeat some bits of it. So things do change, so please do have a look. So the vaccines continue to remain our best line of defence against COVID, and all adults who have not yet received their first or second dose of the vaccine, or those who are eligible for their booster, are encouraged now to come forward and help protect themselves and others. I expect if you're in the centres, you're incredibly busy vaccinating at the moment, and a huge thank you to everybody who's been doing that. So we're going to be concentrating today mostly on Pfizer and Moderna, as this is the preferred choice for the booster programme and for patients under 40 years of age, many of whom we're still trying to encourage to have their first and second vaccines, and many who were getting in for their boosters. For under 18s, we're using the Pfizer. It's really important that you're looking after yourself as well as other people. And if you haven't had your booster and it's due, please make sure that you get it. So as the COVID-19 vaccines have been used more widely during this year, and we've used them very widely now across the world, we have been learning quite a lot about the reactions that they may cause, and further advice around specific contraindications or precautions has been developed. We have learnt loads since the start of the year. So the following information, the guidance has been added. So individuals with a history of immediate onset unexplained anaphylaxis, or anaphylaxis to multiple classes of drugs, or an unexplained anaphylaxis, need a really careful risk assessment and extended monitoring following vaccine. And individuals who have developed myocarditis or pericarditis following the first vaccination also need to be risk assessed. Most of these patients have gone on to have the second or the booster vaccine, but some patients, especially the patients who have been hospitalised, may need a specialist opinion. So PEG remains in the vaccines, and patients who are allergic to PEG should not be vaccinated using either Pfizer or Moderna vaccine. So very, very few people actually can have no vaccine at all. But that said, the next two slides are really, really helpful to risk assess against. I'd say these are really worth printing off, laminating for your wall. I have them in a file in my clinic room. I use them when I'm in charge in the clinics, in the vaccine clinics. Capillary leak syndrome has now been added to the guidance and is now one of the questions when consenting. If you are consenting and you haven't consented for a while, please make sure that you are reading your PGD or your protocol, because some of the questions have changed since our original webinars. So myocarditis and pericarditis, we mentioned this a few minutes ago. It is a rare complication and seen in both Pfizer and Moderna vaccine. Most patients who go on to develop this do so within a week of their vaccination. And for most of them, it's been mild and the patients have been very stable and typically have recovered really fast without any medical treatment. However, some have needed hospital treatment, and for those that have needed hospital treatment, the long-term effects are still unknown. So GBS, there is evidence now that tells us that prior diagnosis of GBS does not predispose individuals to further episodes, and in those who are diagnosed with GBS after the first dose of the vaccine, again, risk can go on for the second after a risk assessment. The balance of risk benefit is usually in favour of completing a full COVID vaccination schedule. If you're consenting, I'm quite sure that you're all well aware how to do this, but this slide is a bit of revision. If you want to have some revision, have a read of it. Consent of children, again for revision. Remember, if you are consenting young people, parents and children do need more time to absorb and understand the information. And it is good practice to give them that extra time to absorb and ask questions. So the legal requirements. So a vaccine is a prescription only medication and you do need a legal entity in order to administer it. There's four main ways really, but the three we're going to discuss, the ones that we use mostly. So there's the PSD, and this is a written instruction signed by a doctor, dentist or non-medical prescriber, and it's for the vaccine to be supplied or administered to a named patient. If you're using this to actually vaccinate, the prescriber does need to assess the patient on an individual basis. The written order must include the dose, the route and frequency of the vaccination, and it's one PSD for one patient. It works well in smaller places, in practices, but it doesn't work very well in the big centres. Lots of you will be used to using a PGD, and especially if you're a nurse or you're working in a pharmacy. And this is for a registered specified health professional to actually give the vaccine, and they can give it directly to a patient with an identified condition. It sets out the core requisites for these people, and it means that if you are using a PGD, that you can actually consent and vaccinate your patient. The healthcare professional working under the PGD is fully responsible for assessing, consenting and ensuring that the patient does fit the criteria that's set out in the PGD. It's used a lot, it's very useful. We also have a national protocol for the COVID vaccine, really useful in the big centres. I use this all the time. And the protocol is a delivery engine which has been new during the pandemic, but it allows a team to deliver the vaccine process. A registrant must still consent the patient, but any competent person can vaccinate. Works really well in the large centres. Remember that the lead of the service does remain responsible for the safety of the delivery of the cycle, so that means for the safety and delivery and competence of a non-registered person. So the vaccines that we're discussing today, the Pfizer and Moderna, need to be stored upright. Once thawed out and on your sites, the Pfizer the undiluted Pfizer vaccine can be stored in a fridge for up to 31 days. Once removed from the fridge, it can be kept up to 2 hours before dilution. Following dilution, you can keep it for 6 hours out, and then it needs to be discarded. The Green Book, Chapter 3, provides extra information re-storage. The Moderna vaccine can be kept unpunctured in your fridge for 30 days. If you've got it out of the fridge and it's at room temperature, you can keep it for 24 hours. Once punctured, you need to use it up within 6 hours. If you have any worries at all about the way it's been stored, don't use the vial, discard it. Make sure that you're happy with what you've got. If you are travelling about with your vaccine or they're moving across sites, make sure that you do use the provided temperature controlled storage bags and make sure that your vaccine is stored upright whilst you're on the move. So it's really, really important that you get the vaccine into muscle. Okay, you need to get it into the deltoid, which is the V at the top of the patient's arm. And getting it into that muscle optimizes the immunogenicity of the vaccine, and it also minimizes reactions on the site. So the best way to find the deltoid is if you put your thumb under the axilla, put your hand across, and it's just above your fingers. Okay. Going to obviously make sure that it's between your fingers and the acromion. You don't want to be going into the shoulder blade. Okay, but it's really, really important that you do get it in the right place. Remember, injecting too high is going to result in a shoulder injury or a frozen shoulder. Injecting too low or too far to the side of the arms, you're going to risk injecting into the axillary nerve or the radial nerve. So do make sure that you are injecting into the right place. There's a quick picture of where it should go, but I'm sure that most of you are doing that. If you don't feel confident to do this, we can organise for you to go into one of our vaccine centres, watch somebody that's confident and perhaps do a few supervised to get you going. We're very happy to sort that out for you. Occasionally, you might find somebody who's very frail and perhaps in the nursing homes or whatever, and there's no muscle mass in their arms. And in that case, you can use the anterior lateral thigh. But I don't think that I've used it at all on the patients that I've vaccinated for the last 12 months. But should you need to, that option is there for you. So anticoagulation, no changes there. If taking medications such as aspirin, clopidogrel, that's fine. If the patients are on warfarin, you need to make sure that their last INR is within their therapeutic window. And if on treatment, say for haemophilia, the best time is straight after their own treatments when the clotting is at their best. These patients have usually discussed with their care providers when best to have the vaccine, but we are still vaccinating. If you are aware that they are on any treatment, you may need to hold a piece of cotton wool a bit longer onto their arm and make sure you press and don't rub, otherwise you're going to get a hematoma. So at the moment, the post-vaccination observation has changed. The government has temporarily dropped the need to supervise patients for 15 minutes after the vaccine, although patients still shouldn't drive for 15 minutes after the vaccine. Disposal of the consumables, no change. We're still shredding the boxes, not putting it in recyclable waste. Anaphylaxis, this has remained rare, but there's always the chance, so make sure you are up to date and make sure you know where your kit is on site. Reporting, we're still asking you to report any adverse and unusual events via the yellow card system. Either you or your patients can use this system. Remember that you stay accountable for your own actions, and if you are the supervisor, you remain accountable for the site and your unregistered staff and your colleagues. So at the moment in GM, we have mostly Pfizer, even though we are beginning to see some Moderna. So we're going to run through Pfizer first. So obviously patients allergic to the contents cannot have this vaccine. Adults can be vaccinated following COVID if it's 4 weeks since their diagnosis. Children who have had COVID can be vaccinated 12 weeks after their COVID virus, unless they're at clinical risk, in which case it's a risk assessment on the site. The vaccine does not contain any preservatives or animal products. We are sometimes asked that. Adverse reactions are as they've always been. There's nothing really new in that. Still raised temperatures, feeling a bit flu-y type thing, usually only for a couple of days. So viral, the viral presentation is the same, other than the name has changed. Community is now the name, and make sure you are using an up-to-date PGD or protocol with the right name on. So when you're vaccinating, you should ensure that you're going to take a full 0.3 ml dose, okay? And that 0.3 ml dose must be from the same vial. You can't get to the end of a vial and think you've got a bit in there and you'll use it up with some from another vial. The whole dose must come from the same vial. So don't pool excess vaccine from multiple vials. We're not allowed to do that. Only sodium chloride for injection can be used to actually dilute the vaccine. And you need to take 1.8 mils of sodium chloride from each of the chloride vials, and then you must discard the rest in that vial. So as we said, a single dose is 0.3 mils. 2 doses of COVID-19 Pfizer BioNTech vaccine are required for completion. And there must be a minimum of 21 days between the 2 doses. Currently, the JCVI is still recommending an interval of 8 weeks, and that's 12 weeks for 12 to 17-year-olds. For the booster, at the moment, the recommendation is a 3 months gap between the second and the booster for all over 18s. If you are thawing your vaccines, if you're in charge of getting them out of the freezer, the vaccine can, once defrosted, can be kept for 2 hours. Well, can be kept for 31 days, but then once it's out of the fridge, can be kept for 2 hours up to 24 degrees before being diluted for use. If you are, I don't think there's many of us that are actually thawing the vaccines, but if we are, make sure that you've completed the right sheets and that your paperwork is all up to date. Okay, so as we said before, make sure that you're recording the time that your vaccine is taking out of the freezer, the time you take it out of the fridge, the time you add your diluent, and make sure that it is used within the time frames that we've stated. If you're out of the time frames, you must waste that vaccine. If you're not happy with any vaccine, please don't use it. So most of the reconstruction hasn't changed, apart from we've now got the inclusion of the vantage point needles. So what I'm going to do is just go through the changes with you. The normal, the things that we've done many times, I'm not going to go through you, but please feel free to read it. So now we've got the new syringes in the packs for drawing up. And I'll just go through using the vantage point combined needle and syringe. So what you need to do with your fluid is measure, with your saline, is to measure the volume using the leading edge of the black plunger seal. Okay, as you're going in there, rotate the plunger handle as you slowly push up to the correct dose of your saline. Once you've got the correct dose of your saline, okay, into your syringe, just add a little bit of air into the top of the syringe before you put the saline into your vial of vaccine. Okay, and then just inject your saline very slowly into the vaccine vial as you did previously. Now that air that you've taken up in there will allow all of the saline to be expelled from the syringe without actually activating the retraction mechanism in the syringes. So remember that you'll be pushing down, okay, and you push it down to the resistant point. Okay, once you've done that and you've got all your saline into the syringe, okay, and you take it out, you can then push your needle down all the way, and that actually activates the retraction mechanism. Once you've done it once, it's really straightforward and easy, but it's really important to remember is once you've got your saline measured to actually put that little tiny bit of air back into your syringe. Otherwise, you actually activate the retraction of the needle before you want to. So the dose preparation hasn't changed. Have a look at the slide if you need to, but it's still 0.3 mils straight into the deltoid. So Moderna, we're beginning to see Moderna now in some of our centres, and we are using Moderna for 18 and overs. We're not using it for children. So like the Pfizer, this is an mRNA vaccine, and it is made with similar technology to the Pfizer vaccine. It's suitable to offer as a primary course or a booster. And remember, if you are using it, check your PGD on your protocol carefully before you start vaccinating. For most of us, this is a new vaccination. Again, like Pfizer, if anybody's allergic to any of the contents, it's contraindicated, and it's also maybe contraindicated for patients who have had a previous systemic allergic anaphylaxis reaction to a previous dose of an mRNA vaccine. So again, you will need to get expert advice and a risk assessment. So like the Pfizer, this vaccine does not contain any animal products or preservatives. Reactions are very much the same. So local reactions in their arms, slight flu feeling for a couple of days, slight fever. It's usually very mild, and it's usually over in a couple of days. Worth remembering, actually, worth mentioning, that the MHRA have received reports of skin reactions following the vaccination site, usually 4 to 11 days following the vaccination. And we've seen more of these rashes with Moderna than we have with Pfizer. So that might be worth mentioning to patients. So the Moderna vial looks like this. Each dose that we're going to use is 0.5 mils, and you should be able to get 10 doses out of a vial. The priming of Moderna, the priming dose of Moderna, as we mentioned, is 0.5 mils. The primary course consists of 2 doses, and again, a minimum of 28 days between doses. And like Pfizer, JCVI is recommending an interval of 8 weeks at the moment, unless different because of a risk assessment. When you have completed your priming dose, your 2 doses, the booster dose is 0.25 mils. Okay, so that's half the priming dose. And again, this should be given to eligible individuals at least 3 months after the 2nd dose. So storage, there are some differences here to the Pfizer vaccine. So this is delivered frozen, and you need to thaw in refrigerated conditions. The manufacturer states 2.5 hours. Once you've thawed, let each vial stand at room temperature for 15 minutes before using. In practice, we have found that it takes slightly longer than the 2.5 hours to thaw. So just be aware of that. So it's taken 3 hours really sometimes for us. So just be aware if you are thawing it. So the unopened vaccine can be stored in the fridge, protected from light, for up to 30 days. The vaccine pack should have a label on the front stating the time that you've removed it from this freezer and put it into your fridges, and the date and the time must be on it. Again, if we're past the 30 days and it's not been used, it must be discarded. If unopened, you can keep your vaccine at room temperature for up to 24 hours. And if you've punctured the vaccine, so you've taken the first dose out, you can keep it for up to 6 hours. So one of the joys of this vaccine is that it doesn't need reconstituting. You can use it straight from the vial. Make sure the times and dates removed from the fridge are there. Make sure that you record what time your first puncture is. So you draw up this vaccine using an aseptic technique, just as you would draw up the Pfizer. Once you're drawing up, please make sure that you keep the vial upright and you don't shake this vaccine. Again, like it's an mRNA, so you must be careful. So with this vaccine, you gently swirl the bottle, okay? And you gently swirl the bottle in between each vaccine, each dose that you take out. Ensure that the vaccine looks okay before you use it. It should be white to off-white, and this vaccine may actually contain white or translucent particles. If it's not that colour, or the particles are not white or translucent, or the vaccine is discoloured, don't use it. And again, we administer this straight away into the deltoid. Okay. So remember, for this vaccine, the dose is 0.5 mils for each primary, and for the booster, it's 0.25 mils. Okay, and as the Pfizer, at the moment, monitoring has been temporarily suspended following the vaccine. So thanks for listening. Thanks for being part of the COVID vaccination teams. Hopefully that our vaccinations will help us come out the other side of this pandemic. So thank you very much.